I'm Dave Rakel. I direct the Integrative Medicine program at the University of Wisconsin. I'm here with my two colleagues who I'll let them introduce themselves.
I'm Luke Fortney, and I am new faculty at the Department of Family Medicine and see patients in consult clinic at Integrative Medicine.
And I'm Rian Podein, Assistant Clinical Professor in the University of Wisconsin School of Public Health and Medicine.
So we just had a conference on green medicine here at Monona Terrace in Madison, which is a great success on how we can create sustainable change. So Ryan, kind of give us your definition of what green medicine is and why it's important.
I think green is a term that is used often and can have lots of different meanings, but I think in general it's connected to the idea of ecological sustainability, and in medicine sustainability and sustainable development is an idea or a concept that can be wrapped up in the term ecologically sustainable medicine or green medicine.
So how does that apply to me in primary care?
Sure. Every action that we do in our lives has an impact or an impact on the environment. So, and many people are familiar with the idea of ecological footprint, and so healthcare itself has an ecological footprint. The interventions we use, the way we create wellness or battle disease, all have an impact that we can measure.
Luke, I've heard you say that nothing else matters other than this. Would you mind expanding on that a little bit?
Yeah. Well, one idea that's been thrown around is, we have one environment, one world. It's the only one we get. If anything, the last 100 years has shown us we haven't been very good at taking care of it. And that's been true across the various industrial sectors, and healthcare certainly has its role in that too. And one of the questions, for example, is how can we protect the environment so that we can maintain the green spaces that help regenerate some of the industrial waste production that society generates, and looking at renewable energies for hospitals, water saving, turning lights off, things like that. And in general, allowing preservation of rainforests, things like that, for development of new medicines, enhancing knowledge of different herbal medicines and things that are sustainable that people can grow right in their own gardens.
Nice. So let's be as practical as we possibly can. I'm a family doc. I see a number of patients during the day. What can I do in my clinic that will help me make an impact, even if it's a very small step in the right direction, in the way I practice medicine or the way I run my physical space?
One thought I have is, if we're talking about green medicine or ecological medicine or sustainable medicine, these are all very similar things. Even integrative medicine, that's really at its core, respecting the environments that we live within and how those affect us. Some of the very practical, easy things would be to take care of yourself, riding your bike to work if you can, not using your car as much. Is one suggestion that I think would have a lot of influence. There's one study that's really interesting that shows the influence of a physician having a bike helmet on their table. And that was the only intervention actually having an impact on the amount of exercise that their patients did without actually referring to it. So I think by modeling these different things, just in that one example, is one of the things that's very powerful and useful.
Yeah. Riding your bike to work.
Yeah.
And putting your helmet on your desk.
Making it visible.
Exactly.
Making your health and your happiness visible.
Walking the talk.
Yeah.
Very good. Ryan, what thoughts?
I think it's exciting in medicine. There's lots of potential from the organizational level. Clinics or spaces that people work in can engage in audits, energy audits, to see how much energy is being used and shoot for goals of reduction over time. Also, waste audits can measure how much waste is being created by a clinic or hospital or whatever area you work in, and shoot for reductions over time to reduce the organizational ecological impact. And then that can also be scaled down to the person-to-person practice of medicine, of thinking about not only the person in front of you, but also that person in context of an environment and a planet. So going back to the precept that we all learn in medical school of do no harm, to think of interventions that are appropriate and effective, that not only help the person in front of you, but don't harm the environment they live in.
Nice. So if I can really get at the root of that, what that person needs to heal and be well, and they start to improve their quality of life, they start to enjoy life, they treat their neighbor a little bit more kindly. I don't have to give them as much fluoxetine for their depression. That won't get into the waters, and that has a positive impact on everybody they come in contact with. So that healing-oriented medicine really is sustainable because we need less external influences to maintain health.
Exactly.
Is that fair?
One thing I might add to that too is something you can do as a primary care doctor is to, by just looking at your templates or how your day flows, for example, it may not work out as well in the pocketbook at the end of the year, but to give your patients more time so you can actually talk with them to find out what's at the root cause versus relying on further testing, further imaging, which has more, the patient has to drive, it's more stress and strain to them, but getting really at the root of many of the mind-body influences on many of the different illnesses.
Nice. So what we're talking about there is giving time to hear their story, to really understand what they need. Otherwise, we just kind of throw more tools at them,
more tools.
tests. Yeah. And sometimes we just need 5 minutes to see the ear. But a lot of times we need, so it's not give everybody that time, it's to really triage the time for most appropriate application.
Right.
Yeah.
And these are really exciting times for medicine to be a leader in ecological friendly medicine. Everything from organizations that have supported this and are leading to green building by many organizations and clinics and hospitals in this country, and all the way to now there are entire meetings around cleaning medicine with incredible verbal support from even the president of the American Medical Association, who's the guest speaker, keynote speaker at this year's Clean Med Conference.
Ryan, can you give us some resources if I wanted to get an audit for my clinic, or if I wanted to learn how to do this better? Are there any websites or organizations that would help?
Some great places to start are, one of the leaders I found is Teleosis, which is a non-profit organization who is a leader in green healthcare programs. And they have produced specific audits based for healthcare clinics. They can be reached at teleosis.org on the internet, and they're based out of California.
How do you spell that, Teleosis?
Teleosis, Teleosis. Healthcare Without Harm has been a leader in helping to green healthcare for a long time, including everything from getting mercury out of hospitals and clinics to working on many other issues. And they have a wonderful website. You can Google Healthcare Without Harm. And
Hospitals for a Healthy Environment is another one that you can Google that has good resources. Something else that I would keep in mind that's a pretty easy, straightforward thing to do is to be more involved with the administration at your hospital to make a difference in your own local environment. Another useful thing is, for example, that Ryan did some work with the spraying of pesticides around the hospital lawns several years ago, and that just took writing a few letters to bring awareness, which is one of the first steps, raising awareness about the impact that we have on our local environment, and then of course increasing action to change that so that we don't cause further harm.
So what we're talking about here, a lot about it, is bring this into our awareness. And you showed me that somewhat comical but also somewhat sad photo of the pesticide, keep your kids off the grass sign in front of our children's hospital.
Yeah.
which kind of goes, brings that into stark awareness of the importance of walking the talk, of first doing this in medicine, where our duty is to really try and keep people well and making sure we're not negating that process.
Also, prevention is worth more than a pound in cure.
Very good.
Yeah.
So, Dr. Rian Podein, Dr. Luke Fortney, myself, David Rakel, thank you.
thank you.
Thank you.
Thanks.
Thank you.
Thank you. No, thank you.